Rheumatoid arthritis is a chronic multisystem autoimmune disorder. When I say autoimmune, it means that the cells of your body, they tend to act against other cells in the body, thus leading to some destructive changes. Rheumatoid arthritis is typically a disease which affects the joints, but then thereon it also has some extra articular manifestations. That means that uh, it affects the joints and the structures around the joints in our body, as well as it can affect the skin, heart, lungs, and other vital major organs, and even the nervous system. It is different from other forms of arthritis because it's an inflammatory form of arthritis, whereas the more uh, commonly encountered arthritis, that is we see in elderly individuals, osteoarthritis, which has been classically typecast into a non-inflammatory form of arthritis. In inflammatory arthritis, what happens is there is a dysregulation of our immune system, and a lot of chemical mediators inside our body, they tend to work against the synovial lining of the joints, along with leading to the destruction of the cartilages and the bone and the bones, and formation of new bone. And so it's a big process. So these changes which is happening, it can happen after small triggers like again, rheumatoid arthritis is a multifactorial disease, and no such single agent has been isolated so far, but it has been postulated that a dysregulated immune system, which has been triggered by cigarette smoking, infections, and other environmental triggers, which causes this the immune system to start malfunctioning. And rheumatoid arthritis is a condition which can even start off when one is small. We have forms of rheumatoid arthritis known as the juvenile idiopathic arthritis, wherein the typical immunological features that what we encounter in elderly is seen even in children. And these children, those who are suffering from juvenile idiopathic arthritis, again a type of inflammatory arthritis, they tend to, in later life, they tend to have more florid forms of rheumatoid arthritis in case if the disease is not identified and treated properly in the during the childhood. Rheumatoid arthritis, the causes of it are multifactorial. At the outset, there is a role of genetics again. It tends to run within families. It uh, it has an HLA correlation. That is why it tends to run within families. Twins tend to be affected. Siblings whose parents have been affected with rheumatoid arthritis, their frequency of the disease is higher in these individuals. There are certain trigger factors like cigarette smoking, then infections, and lot of unknown environmental triggers, which kind of leads to the setting of the immune system, and it starts acting on its own and destroying the joints and the bone, the cartilages and bones. Rheumatoid arthritis is starts off with very non-specific symptoms. It could be fever. You might be feeling a bit lethargic. You might be feeling a bit of malaise. Might bit of soreness of the joints. But as the disease evolves, the primary symptom that patients come to us with are that they have pain and swelling. It can be either pain or it can be pain and swelling both together, involving the joints of their hands as well as feet. This is the most important complaint that the patients comes to us with. And this episode generally happens early morning. So they might be saying that I am unable to make a fist or my joints feel stiff the moment I wake up. The moment I am getting down from the bed, my feet hurt because of the small joints of the feet. They are inflamed, and I am unable to hold the first cup of tea that I take in the morning. If it is affecting larger joints, the patient might find it difficult to perform their hygiene activities like going to the washroom, getting up from the using the washroom, and doing their daily activities. Now, this stiffness is something that is very unique to rheumatoid arthritis, and this kind of differentiates it from other forms of non-inflammatory arthritis, wherein that the stiffness generally lasts from half an hour to 1 hour. Pain and swelling of the joints, they tend to recover after the person starts indulging in some activity. So the patients generally come to us with that their their joints are swollen, their hands and feet are feeling stiff, their knees are feeling stiff. But the moment they start walking around, they do some sort of activity, their stiffness reduces. This is one of the ways that rheumatoid arthritis is diagnosed. Now, as in elderly individuals, sometimes what happens is the articular manifestations, like the bony manifestations of rheumatoid arthritis, are also there. And like I mentioned, rheumatoid arthritis starts from the joints and ends in other organs. Most commonly, that what happens is rheumatoid arthritis also affects the lungs. It causes something called as interstitial lung disease, which leads to shortness of breath and recurrent cough, dry cough, shortness of breath, recurrent infections. And that's how when it comes to the fore in case of elderly individuals. These are extraarticular manifestations and complicated sequelae of rheumatoid arthritis. The treatment of rheumatoid arthritis is based on early diagnosis and detection. So for diagnosing rheumatoid arthritis, there are certain tests, blood tests, which need to be done, a profile of tests which assays certain parameters in our blood, which tells us whether we have the disease or not. Similarly, we also opt for radiological investigations of the hands and feet, ultrasonography of the joints and the joint cavities. Sometimes MRI might be required for the cervical, for the spine, to see if there are any kind of complications of rheumatoid arthritis that is happening or not. If the lungs are involved, then pulmonary function testing, chest X-rays, CT scans might be required. Overall, what happens is the mainstay is blood investigations like C-reactive protein, rheumatoid factor, anti-CCP, and a host of other blood tests that needs to be done. And most importantly, along with this, what happens is that set international guidelines also gives quite a lot of weightage to what the patients are saying. What the clinical examination of the patients tells us, the symptoms of the patients. Along with that, the blood tests are there to help us in diagnosing rheumatoid arthritis. Once that is diagnosed, then we have to next assess the level of severity of the disease. Based on that, treatment is initiated. There are, in rheumatoid arthritis, it simply won't go away with over-the-counter painkillers. We have to introduce something known as the disease-modifying anti-rheumatic drugs, or the DMARDs. There are lots of DMARDs which are available for clinicians to use, and it's heartening to know that newer molecules are also being discovered and they are being used in daily clinical practice as we speak, because there has been an increased interest in the field of rheumatology and clinical immunology, which has led to better understanding of the disease process and the mediators, the chemical mediators, the inflammatory markers that are associated with this disease. So once we gain a better understanding of it, newer drugs will come to the fore. But like I mentioned, the disease modifying anti-rheumatic drugs, there are many classes. There are the conventional DMARDs, there are some synthetic DMARDs, there are some biological DMARDs, and they target certain aspects of the inflammatory cascade that has been propagating this disease. Along with that, the treatment also involves good physiotherapy on part of the patient that helps in relieving the pain. And the objective of the treatment protocol should be to manage the disease at the most minimal level possible, and to prevent any complications arising due to the disease, and to keep a check on whether there are any other complications, extra-articular complications, which are manifesting in the patient, and adequately managing them. In rheumatoid arthritis, once it has been diagnosed, based on the severity of the disease, it is advisable to take medications in liaison with your consultant physician. And the doctor is very well versed with rheumatoid arthritis. The doctor is the best judge to assess the patient's clinical status, his disease inflammatory markers, and accordingly, upgrade or titrate his dosage regimen. There are some cases where the person does not require a lot of medicines, and he might just survive, or he might just benefit just with using one drug. But then there are certain cases where one might have to use a number of drugs to induce remission. And once the disease is controlled, the doctors then will try to, taper down the drugs. But all of this takes time and expertise, and it has to be in a constant liaison between the doctor and the patient and other stakeholders. The patients who are affected with this disease, they tend to come to us with complaints that the pain and the swelling and the stiffness, they all disappear after they are doing their daily activities. Now, that is what we advise to our patients, that you have to be physically very active. You have to go for a strict exercise regimen wherein that reduces the amount of stiffness that you experience in the morning hours when you wake up from sleep. So once you go into a good exercise regimen, which involves, exercising all those joints which are affected, like the small joints of the hand, the feet, sometimes it could be a shoulder, knee joint, elbow joint, and even your wrist joint. Specific exercises demonstrated by the doctor, enforced by the physiotherapist, practiced by the patient, has to be undergone for a long period of time. And it has to be done in conjunction with the medicines that the person is taking. It has to be remembered that exercise might not be always possible if the person is in tremendous pain. That has to be discussed again with the physician, who gives you medications to reduce the pain and the inflammation to a tolerable level, and then you can start exercising. Then there are other complications of rheumatoid arthritis wherein your spinal mobility may be affected. Those cases, these are again advanced rheumatoid arthritis cases where exercising may not be totally correct thing to do. But overall, exercise forms a major part of the treatment protocol for every rheumatoid arthritis patient when he or she is diagnosed with this disease condition. It is a mainstay of therapy along with drugs. And in fact, those patients who exercise, those who are into a regimen, these patients tend to achieve, of course, along with medicines, they tend to achieve remission of the disease. They also tend to be on lower number of medicines when the time progresses.